Iowa Live.
From the Carl Chevrolet Studios in West Des Moines, welcome to Iowa Live. I am Lou. And has your doctor told you that you need knee replacement surgery? Well, hold the phone, because Dr. Josiah Fitzsimmons is here from Vero Health Center saying that that might not necessarily be needed, because they have incredible treatments at the Vero Health Center right now. I don't think anybody wants to have knee replacement surgery, doctor.
No, I mean, who would want to go through all the rehab, the issues, the problems that could happen with knee replacement surgery?
Yeah, let's talk a little bit about that so people know what they're in for.
Absolutely. So typical knee replacement these days lasts about 10 to 15 years. So when you're a younger person and you get a knee replacement and you want to live for another 10 to 15 years, you might be looking at another one. And so before I became the doctor that I am today, I actually wanted to be an orthopedic surgeon, and I would actually observed lots of knee replacement surgeries. And so literally what they're doing is they're cutting off the bottom of your femur and the top of your tibia and your fibula in the bottom part of your leg, and they're putting in a whole new part. And so when that is done, it can't be undone. And so unfortunately there can be lots and lots of different complications that can happen with knee surgeries. And so you really want to try and avoid those. Get your knee corrected naturally as best as possible and avoid those types of invasive surgeries where that can't go backwards from.
That sounds brutal.
No, it is brutal. I mean, honestly, the surgeon joked with me that he was a carpenter as he was cutting off the bottom of someone's leg, and it sounds very gruesome, and it is.
Yeah.
And we want to help people avoid those. You want to get out of pain, you want to enjoy your life, you don't want to have to have your knee cut, then you come to Vero.
Now, what about like recovery time? What are we talking typically for that, just after you have it done?
Yeah, typically you're looking at somewhere between 8 and 12 weeks, for rehab, recovery, very intensive recovery and rehab that you have to go for a very extenuous period of time, with the different molds and so forth that they have in the knee replacements. They might not get the sizing exactly right, and then one of your legs might be a little bit longer, a little bit shorter than the other when you're done. Then you could start to have other issues, back problems, it could just kind of turn its way into other problems. Once the foundation of your house gets off, your windows don't close, your doors don't shut, you start getting more and more problems. So one issue can turn into many other problems.
Okay, now you mentioned back problems. Could that be the issue, though?
Back problems can be a big part of issues with knee problems in the first place. Absolutely, that's a great question, Lou, because everything's all connected. And so oftentimes people just want to treat where the symptom is rather than correcting what the actual cause of the problems. Like I said earlier, easiest example I like to talk about all the time is the foundation of your house is off, your windows don't close, your doors don't shut. You go get new windows, you go get new doors, but you never fix the foundation of your house. Same thing, you could have hip misalignments that are altering your biomechanics and your gait, therefore you're walking differently, therefore you start having knee issues. Well, then you think you need to get your knee fixed. Well, you need to fix your back problems or the other issues up the chain of command on the flip side. Or it could be the opposite. You could have knee issues, therefore you're walking and your biomechanics are altered, therefore you start to develop back problems. So everything's all interconnected. And so instead of treating one individual issue at a time, we need to look at the whole body as a whole, correct the whole body. And that's exactly what we do. All of our doctors will do a full analysis of your entire body and figure out exactly what's going on, so we come up with a comprehensive game plan. We actually have a 4-part treatment protocol specifically for knees. We want to improve the blood flow to that area, regenerate the tissues, use regenerative protocols. We also have a machine that can help decompress and bring fluid back into the knee joint.
Okay.
Really, really amazing device. And then on top of all that, our doctors are actually going to work with the alignment of your hips, of your knee, of your back, all those different areas in your body, so that everything can just be properly restored and your body has the best chance to heal naturally from the inside and avoid surgery.
So it is the synergy of all parts working at the same time.
Yeah, exactly. I kind of like to call it our knee recipe per se, that we're putting all these different parts together. just doing one thing here or there might get you some results, but really the synergistic impact of all these different protocols to improve the blood flow, recreate that spacing, put the fluid back in the space, make sure the alignment in the knee is correct, make sure the alignment's in the hips, the backs, the ankle, joints above and below, you want to have fixed and corrected and get in proper alignment as well, because they all impact each other. We can't just focus on one thing, forget about the rest, and hope we get good results.
So if you've heard those 3 words, knee replacement surgery, stop for a second, seriously. And you have a special going on now that is great, where you can really give people the answers that they're looking for.
Yeah, absolutely, Lou. We've had many people that have already been scheduled for knee replacement surgery come into our office and they say, hey, I want to try and avoid it, and they end up canceling their surgery.
Wow.
Get rid of their knee pain, get their life back on track, avoid it without drugs, without surgery. And so, yeah, come to our office. We have an amazing special to get the initial treatments. Normally it's $237 to get all the initial exams, consultations, meet with the doctor, figure out exactly what's going on, come up with a game plan. But right now we have a special for Iowa Live, only $37.
$37. Instead of saving $200.
Yeah, I mean, you get to meet with a doctor, you get to meet with our care specialist, you get to see exactly what's going on, go through a detailed examination, figure out exactly what you have going on, how your body can get helped, and do something about it.
And how soon can somebody be seen?
I mean, we have 11 doctors in our one
11
clinic.
now?
Yeah.
Wow.
So, I mean, people can get in typically within just a few 24 to 48 hours, come in, come up with a game plan, figure out exactly what's going on, and then, like I said, let's get going on this. With knee issues, that you got arthritis, you have degeneration, it's just going to get worse and worse, harder and harder to do anything. The more you're trying to be active, it's summer, the weather's getting nice, you want to get outside, you want to enjoy your life, you don't want to be held back because of your knee issues, and you can't enjoy time with your grandkids or your loved ones or your friends, go on walks with your spouse, whatever you want to do, play with your dogs.
Yep.
No matter what you want to do in your life, right, you don't want to be held back by your health, and knee issues are so debilitating because if you can't walk, you can't do much.
Right. I'm glad you said play with your dogs.
Yeah.
Give them a call, folks. 515-335-VERO. That's the number, 515-335-VERO. Make an appointment, $37. Find out if you can avoid that knee replacement surgery and just get fixed over at Vero Health Center. Thank you so much, sir. Appreciate it.
Thanks for having me.
We will be right back. This is Iowa Live.